Science.
Doctors from all over the world are heading for Lisbon to learn how to perform a new medical procedure that may improve the quality of life for millions of men suffering from prostate enlargement. This condition, known as benign prostate hyperplasia, BPH, affects all men at one point or another in life. The question is not if you'll suffer from it, but when. 70% of the elderly suffer from BPH. The new treatment was discovered by Dr. João Martins Piscu at the St. Louis Hospital in Lisbon, Portugal. It's called prostatic artery embolization, and it blocks blood supply. It's performed under local anesthetic and monitored. We catheterize selectively prostatic arteries, arteries that are very tiny, with microcatheters. Through these catheters, we introduce small plastic particles with which we block part of the prostate arteries. As prostatic arteries are blocked, this naturally leads to a reduction in size of the prostate, with the elimination or improvement of symptoms for most patients. The prostate is a small gland located below the bladder. As it grows, it blocks urine flow, so you need to urinate more often. In more serious cases, a catheter and a bag are needed. This patient seemed perfectly comfortable ahead of his operation. I'm very hopeful because if it works, and I'm sure it will work, it's going to be really good. Everybody knows very well what the consequences of prostate surgery are, and they may be serious. This is not the case with this method. Patients fear prostate surgery because it may lead to incontinency and sexual malfunction. For the moment, patients have to come to Lisbon to undergo the procedure, but it's being rolled out in 30 American clinics this year. The Portuguese doctor's been busy teaching the technique.
This method is very impressive because represents one of the alternatives to the treatment mini-invasive for BPH. And we know that there are a lot of treatment, but the results are not very impressive, very efficacious. In this case, we saw the possibility to have a really mini-invasive method that can improve the quality of life of the patients with the BPH.
I think it's a revolutionary method. It offers an alternative. Patients are treated avoiding the complications associated with surgery. It's a relatively quick procedure. The patient can go home the same day, without pain. This procedure has been successful in 85 to 90% of patients. Dr. Martins Piscu treated nearly 200 people. He has some happy stories to tell. Very often, the day after the procedure, when I call patients who used to wake up several times during the night, they tell me they only got up once. The patient urinates less frequently with a better flow. This provides extraordinary symptom relief. There was a journalist from Hong Kong that came here for treatment. His prostate weighed 130 grams, but today it weighs only 70. He's very happy, he wants to have children, and he doesn't need the catheter to pass urine. While other techniques may affect the sexual function, this one has the advantage of not affecting the sexual function.